Good afternoon, friends. Welcome back to pediatric classes. Today we'll discuss about the recent norovirus infections. As you all know, the Kerala has reported cases of norovirus infection in children yesterday. So let us now just go through what exactly is this norovirus infection, what does it cause, what are the clinical features and other things. So with this intro, let me start sharing my screen. And if you have not yet subscribed to my channel, please do subscribe and support our initiative. So with this, this is about the norovirus infection. Okay, so what exactly is this norovirus? Norovirus are they are a group of viruses that cause gastroenteritis. So they are single-stranded RNA viruses. They are also known as winter vomiting bug. It's a very contagious disease that infects people of any age. And previously, these were actually called Norwalk virus or Norwalk-like viruses. Now it is called noroviruses. They were previously called as stomach flu incorrectly, but please note here, it does not have any relation to the normal flu. That is this is a respiratory illness which is caused by the influenza virus. Okay, so I've also put an image of the norovirus which I got from the net. So how does it spread? The virus mainly spreads from infected people to others. That is a fecal-oral sort of spread through contaminated food and water by touching surfaces or objects that have viruses on them. So there are different modes of spread. And another thing is eating oysters which are not properly cooked. So that is about the outbreaks. These outbreaks have occurred from these undercooked oysters. These oysters may be harvested from contaminated waters or this, but please note here, cooking, a proper cooking can kill this virus. Okay, then drinking water contaminated by sewage can also be a source of the illness. So what is the incubation period of this norovirus infection? No, incubation period is generally around 12 to 24 hours usually, but it can be as less as 10 hours also. Symptoms are more pronounced in babies, children, pregnant women, elderly, and in immunocompromised patients. So what are the clinical features? So please note here the clinical features include nausea, vomiting, diarrhea, stomach cramping. Sometimes the people tend to have a low-grade fever, chills, headache, muscle aches, etc. And there can also be a general sense of tiredness or lethargy. Though these babies, they tend to be more lethargic. Though the diarrhea component will be slightly less in very small babies, but they tend to be more lethargic. So the presentation can actually vary, but most of the gastroenteritis it causes. So all these clinical features you can get in a norovirus infection. So, but the point to note here is, so this whether it is a norovirus infection or whether it is a rotaviral infection or any other virus infection, so once a patient comes to you with diarrhea, so today actually I encountered that question whenever people have actually come, the reported cases from Kerala has come from a particular school, means from some of the children from the school have been brought to a hospital too, and the parents are asking, is this a noroviral infection? So it may be. That's the only thing we can, unless we get a diagnostic confirmation. But actually, it is a clinical diagnosis. So one thing we should note here, another thing is, unlike bacterial infection, the norovirus does not cause blood or pus in stool. And another interesting point is infected people do not become long-term carriers of norovirus. Okay, maximum up to 3 days we have to be careful after the infection. In most cases, these symptoms clear out within 2 to 3 days, except in some patients whom the symptoms may last up to a week, like especially in immunocompromised patients and other elderly. And so otherwise, the symptomatology is mostly for 2 to 3 days. Infants, children, pregnant women and elderly can actually develop complications like dehydration. So we have to make sure that they drink lots of water and we have to maintain that the hydration is well maintained. So what is the exact infective period of this norovirus infection? The norovirus infection is, these people are actually, patients are contagious from the moment they begin feeling ill to at least about 3 days after recovery. Some people may be contagious for as long as 2 weeks after recovery. So we need to practice good hand washing technique, number one. And when, please note, when the people who are actually preparing foods, they have should not be making food for the family or the friends or all the people at least for 3 days after they recover. So these 2 points have to be noted very clearly. Hand washing technique, and also that at least for 3 days, these people should be exempted after recovery, or 3 days post recovery. 3 days they should not be allowed to make food for the others. So diagnosis, I already told, is mostly a clinical diagnosis, but there are diagnostic methods for norovirus. It is focused on detecting the viral RNA, that is a genetic material, or the viral antigen using the reverse transcriptase PCR or RT-PCR. So what about the treatment? There are no specific treatment, only the supportive treatment. Like for a patient is having fever, give paracetamol. If there's vomiting, give anti-emetic. If there's diarrhea, we encourage all of them to take lots of oral fluids. And if somebody is developing a severe dehydration, they have to be hospitalized and IV fluids have to be given. Please note here, there is no role for antibiotics in a norovirus infection, because norovirus, as you know, is a viral disease. Now you will ask me, is there any antiviral? That is also not yet known. So how can you prevent the disease? The prevention is by taking a healthy diet. So rinse the fruits and vegetables thoroughly and stay home when sick, and for 2 to 3 days after the symptoms stop. And avoid preparing food for others when the person is sick, and for around 3 days after the symptoms stop, which we have actually discussed a bit before. And suppose you are eating shellfish, cook it thoroughly so that it kills any viruses if it is carrying. Currently, no vaccine is available for norovirus infection. So how can we disinfect? So we have to use a disinfect. So we can use a household bleach should be there. Please note, or we can use a combination of a bleach and hot water to disinfect the area. All the possibly contaminated, like now post this COVID disease, people will be knowing about this contact precautions, other things. Almost everything we have to follow. Disinfect potentially contaminated household surfaces, commonly used objects such as toilets, taps, telephones, door handles, kitchen surfaces, and any other point of contact with the patient. We have to disinfect and wash any contaminated clothing or bedding using detergent, and at higher temperature around 60 degrees we have to wash it. And if possible, always wear disposable gloves while handling the contaminated items. So the contact precautions are really important in sorry. And another thing is, interesting point to note here is, see, reinfections are very common in norovirus infections. Why? Because there are many strains of this viruses, so it can actually cause a reinfection also. And there are no long-term health hazards. And I already told us there's no long-term carriers for this norovirus infection. So this is in short about norovirus infection. We actually discussed that it is an RNA virus which actually causes a gastroenteritis. It can actually cause outbreaks. It is very contagious, so we have to be very careful. It presents as nausea, vomiting, abdominal cramps, fever. So make sure that give a supportive treatment to the patient. Make sure that we are actually following strict contact precautions, and it is mainly a fecal-oral spread, and also through eating contaminated foods and food and water. So make sure that the person is better, not isolated for another 3 days. At least they should be actually not allowed to go to school, or not allowed to cook food for other people, because that actually may cause a spread to the others. So this is in short about norovirus infection disease. I hope you like this video, and if you like this video, please do comment, share, and subscribe to this channel. Thank you and stay safe.